Hi, I'm Zach with Gotham Physical Therapy, and I just wanted to show you an exercise that you can do anywhere, including at work, to help relieve pain that you may get anywhere here from the shoulders up. So up here, in your neck, even in your jaw, headaches, or in your upper back. The first thing you're going to do is check your range of motion. So for this exercise, it's appropriate if your neck range of motion is equal in each direction. So you can just turn your head to the left, turn it to the right. If those are equal, then this is the exercise for you, okay? And what you're gonna do is you're gonna get your shoulder blades down and back, and you're gonna give yourself a chin tuck, okay? So you're just gonna kind of back your head up, just like that. We're not looking up, not looking down, okay? And then once you've done that, you're going to use your hand, the web space, right under your nose, and then you're going to press straight back. So get in that position, hand right here, press straight back. Just like that. You're going to repeat that 10 to 15 times. Each time that you do it, you just want to make sure that you have your head all the way back first, and then you'll push. Relax, back, push, just like that. Okay? Looking at it from the side, shoulder blades down, back, big chin tuck first, my hand right there, pushing back, relax, back, relax. So you're getting as far back as you can go with your muscles first, and then your hand is going to give a little overpressure, just like that. So that exercise right there, you can use it either to prevent pain from coming on, especially if you're working at the computer all day. You can also use it to help relieve some of that pain as well. It's meant to be done pretty frequently, ideally done pretty frequently. Sometimes every 2 to 3 hours, maybe even more. I sometimes tell clients every 30 minutes take a break and try that exercise, do 10 to 15 repetitions and see how it works for you. Hi, I'm Zach with Gotham Physical Therapy, and I just wanted to show you an exercise that you could do anywhere, including at work, to help prevent or relieve pain that you may have basically from your neck on down into your upper trap, your shoulder, your upper back, around your shoulder blade, all of those things. So the first thing that you're going to do is check your range of motion, okay? So you're going to turn your head to the left, you're going to turn it to the right, check that those are equal. This exercise is meant to be done if you find that you have unequal range of motion. So say I have pain on my right side and I do this check, and when I go to the right, I can see that I can't go quite as far. If that's the case, then this is the appropriate exercise for you. So what you're going to do is you're going to start with a chin tuck. So you're just going to think about that chin going straight back, just like that, like you're giving yourself a double chin, okay? Since I'm going to go to the right, I'm going to take my left hand, put it up high on my ribs like a strut, because I want these muscles right here to be on slack. My goal is not to stretch these muscles, but instead to get my neck bent to the right as far as I can go. So I've got this here, I do a chin tuck, I take my right hand, left side of the head, and I bring my head over as far as I can go, okay? Right back to center, and then over as far as I can go. Okay, just like that. Want to make sure that chin stays tucked in when you do this, okay? So I'm not letting that jut out, stays tucked, just like that. Okay, and we're doing 10 to 15 repetitions of that exercise. It's meant to be done pretty frequently. So sometimes you may do that, and on the first set, you don't really notice much of a difference. Ideally, you're going to do that exercise several times throughout the day. I usually tell clients, hopefully they're taking 30-minute or a break every 30 minutes to just do some sort of mobilization. I think that's a good time to do that exercise. I'll show it to you from the side. Okay, chin tuck. I got my hand up here. Okay, That exercise may be a little uncomfortable. When you do that, when you bring your head to the right, you may have a little soreness in your neck. That's okay as long as it's not getting worse, as long as you're not feeling pain spreading down your arm. It's okay to have a little bit of soreness in your neck when you do the exercise. That is expected, but if you have a little soreness, it should go away pretty quickly. Obviously, we're not trying to make things worse. So give it a try, see what happens. Hi, I'm Zach with Gotham Physical Therapy, and I wanted to show you an exercise to prevent or reduce pain that you may have in your upper neck, your headaches, and even your jaw. And this exercise is appropriate if you have that pain on one side and you also notice a lack of range of motion in your neck. So say I have this pain on the left side here, and then I check my range of motion left and right. So I go right, I've got good range of motion. I go left and I notice I can't go as far and I have pain on the left side. Then what I want to do is first of all start with a chin tuck, okay? When I do a chin tuck, I'm just sliding my head back, giving myself a double chin. I'm not looking up and I'm not looking down, just straight back, okay? And once I've done that, I want to turn my head as far as I can get it to the left. So I'm going to turn my head to the left, give a little overpressure with my hand, and then come back to center. Left, overpressure, come back to center. Left, overpressure, come back to center. I keep my chin tucked the whole time when I do that, okay? I don't let that go and have it jut out. So chin stays tucked the whole time. I turn to the left, a little overpressure with my hand, just like that. So when you do this exercise, you may notice a little bit of soreness here in the top of your neck, and that is okay, nothing to be alarmed about. Expected to have a little bit of soreness with that. We don't want it getting worse though, so if it gets worse, don't force it. And you shouldn't be experiencing any sort of nerve type pain, things spreading down your arm or anything like that. So if that's the case, stop as well. The exercise is meant to be done 10 to 15 repetitions at a time and done fairly frequently throughout the day. If you do it once and don't notice a difference, that doesn't mean that it doesn't work. It is a repeated motions exercise, so the intent is for you to do it frequently. Generally, we start somewhere between every 2 and 3 hours, but most people probably need it a little bit more often than that, and I will generally tell clients who I've already told to take a break from their seated desk work every 30 minutes. During that break, that's a good exercise to do. So give it a try, have some patience, stick with it a little bit, and see what happens.